This presentation covers basic concepts of pharmacology. Pharmacology is the study of drugs, their properties, effects, and uses. In the many years that I studied pharmacology, I found that the emphasis was on how drugs work in the body. Understanding how drugs work makes learning their uses and side effects much easier. Pharmacotherapeutics is the study of how drugs are used in the treatment and prevention of disease. Pharmacokinetics, pharma meaning drug, kinetic meaning motion, is the study of the time course of drug absorption, distribution, metabolism, and excretion of drugs. In simple terms, it is what the body does with the drug. Pharmacodynamics, on the other hand, is the study of the relationship of the drug dose and the duration and intensity of the response to the drug. To contrast it from pharmacokinetics, it is what the drug does to the body. A drug is a substance or compound that has a physiologic effect when introduced into or onto the body. Although there are many routes of drug administration, by mouth or orally is the most common. Many drugs cannot be administered orally because they are broken down by stomach acid, or they're too large, or have some physical or chemical property that prevents absorption via the GI tract. When drugs are administered intravenously or IV, because the drug enters the bloodstream directly, the response or effect of that drug is seen immediately. Drug effects are more intense, and higher doses can be given when it's given IV. Systemic means the drug enters and reaches all parts of the body. Most drugs that are designed to be given orally do reach the systemic circulation. Curare, an extract from a plant grown in Central and South America, it blocks acetylcholine receptor at the neuromuscular junction, causing paralysis. Natives of many South American tribes used the poison by shooting arrows or blowgun darts dipped in curare. Death occurs by asphyxiation due to paralysis of the respiratory muscles. Curare is not toxic if it's taken orally. We now use these drugs very similar to curare, such as vecuronium, to paralyze patients during surgery, but of course they are put on a ventilator first. Local action means the drug is given directly to the target organ and doesn't reach the circulation to any great degree. Examples of topical medications are eye drops given for glaucoma or cortisone cream applied to a skin rash. A fairly new route of administration is by transdermal patch. The drug is placed in a reservoir that is specially designed in the patch, which allows the drug to be absorbed through the skin into the bloodstream at a constant rate over many hours or days. A good example of this is the fentanyl transdermal patch, designed to treat severe pain associated with terminal cancer. As I previously stated, drugs that are designed to be given orally do reach the systemic circulation. However, the amount of the dose that reaches the circulation may not be 100% of the dose given. One factor that can affect this is the first-pass metabolism by the liver. A portion of the drug in the GI tract enters the portal circulation, that means through the liver, before it proceeds to the rest of the intestines. Depending on how fast the liver metabolizes a particular drug, a significant portion of the drug can be broken down before it's ever absorbed. Drugs affected by first-pass metabolism have oral doses that are much higher than the dose that would be given IV. Some examples of drugs affected by first-pass metabolism include propranolol, morphine, and hydralazine. Bioavailability is the extent of absorption of a drug, or what percent of the dose that reaches the systemic circulation. Fentanyl is poorly absorbed orally. The dose of fentanyl when given IV is about 25 micrograms. As I mentioned in the previous slide, fentanyl is available as a transdermal patch. The standard fentanyl patch delivers 25 micrograms of fentanyl per hour through the skin into the blood. The patch is designed to be given every 3 days or every 72 hours. So how much fentanyl is in a patch? 25 micrograms times 72 micrograms per hour is 1,800 micrograms. Easy to understand how an overdose could occur if a patch is abused by injecting, snorting, or chewing its contents. This is very probably how Prince overdosed on fentanyl. Drugs are used in many, many ways. You probably think the most common thing they're used for is to cure disease, but very few drugs actually cure diseases. Can you think of any? You might say antibiotics cure disease, however, most do not. Unless the patient has a healthy immune system, most antibiotics will not cure the infection. Other reasons drugs are given include comfort, as in pain relief, disease prevention, like vaccines. The most common reason drugs are used is to control or prevent symptoms of a disease, or to slow disease progression, as in high blood pressure. Most drugs work by interacting with the receptor, which will be the topic of our next lecture. However, there are many drugs that work by non-receptor mechanisms. Many laxatives work by osmotic properties, meaning they cause retention of water in the intestines. A buffer like calcium carbonate in Tums can relieve hyperacidity in the stomach. Alcohol 70% works topically on the skin by denaturing or breaking down proteins. A few drugs act as chelators, combining with a substance to remove it from the body.